So today I'm here with Noah Tile, who is a registered psychotherapist and the co-founder of Resolve, which is a student mental health platform that we're going to learn more about today. And then we have a little fun Q&A period at the end. So I'm excited to dive a little bit more into the topics of ADHD and OCD specifically. So before we get started, Noah, do you want to just take a second to introduce yourself?
Yes, I'm so thankful to be able to be on podcasts and being interviewed because a lot of my day is talking to other people about their lives and then interviewing a lot of people about their lives too. So it's nice. The question was, tell me about yourself and what do I do?
Yeah.
Okay, amazing. I would love to do that. So I am a registered psychotherapist here in Ontario, Canada, in private practice, mostly working with OCD and ADHD. Those are two of my main areas of focus. I do a lot as well in coaching within those areas because for both of those issues, which we're going to get into, a coaching model really, really works well. And we'll talk all about that as it comes up. I'm also a rabbi. So there's a lot of overlap between being a psychotherapist and a rabbi, which I can share a little bit about as well. But mostly I'm working with people asking big questions, helping people with issues that are going on, but also defining their life, defining who they are, who they want to be on a deeper level that is going to help reflect a life better lived. And I think that that's a big part of what I do. And then we have Resolve Mental Health. What I noticed in the university system in particular, but it trickles down into the high school system, is that mental health is compartmentalized. So we have different offices. We have health and wellness. We have accessibility services, and we have the career and wellness or career development center, let's say. And so you have students who are trying to work on a whole host of issues. Maybe they're feeling anxious, but they don't really know where they're going. They're having trouble focusing in school. There's all these comorbid situations going on, and they might have some sort of, inkling that I should go to the accessibility services, or maybe they have an inkling I should go to health and wellness. I don't really know. But maybe I haven't even spoken to somebody yet, and now I'm already being sent to different people to talk about things that are seemingly interconnected. For example, somebody may be feeling anxious because they don't know where they want to go with their life, but also they're having a tough time focusing, and their anxiety might be the part that's causing the executive function issues. We just don't know. It's all over the place. And so Resolve is attempting to solve a problem of psychotherapy integration. Instead of going to one place for one issue and another place for another, Resolve has all registered psychotherapists that are dealing with all those three boxes: mental health, academic success and executive function support, and personal growth in that career and life direction. So that's a big problem we've noticed. And also lower cost. Therapy is pretty expensive. Some universities have great internal services, but sometimes it's shorter term. There isn't necessarily you're going to get that in the long term. As well, in high schools, there's barely any infrastructure. Some schools might have guidance counseling, maybe a social worker on board, but we're really attempting to solve a problem of high quality access to low cost therapy that integrates the student life together. I think that's kind of what we're doing, in addition to educational content and peer support and learning and all sorts of other things that mental health is about. It's not just about therapy. It's about access to learning, skills, development that you might find you get in therapy, but you don't necessarily need therapy to do.
Amazing.
That was a lot.
Yeah, thanks
but
for
yeah,
sharing
that's what we're doing.
Fair. But yeah, no, you talked a little bit about how you found like a need for a platform like this because a lot of the mental health services, like you said, are kind of very broad and nobody knows what direction to go. So I think it's awesome that you started this platform for student mental health and you kind of make that easier for the students to navigate. Can you expand a little bit more on how the platform works and some of your goals with the platform?
For sure. So it's very simple, thankfully, in terms of how we run things. So I'm not the clinical director or take on the role of the supervisor of the practice, although I have extensive interviews with people and do a lot of quality control, but other people have their own external supervision and I do a lot of support. But essentially we hire therapists that work for Resolve, and they see clients. The wait times are little to none. All you have to do is book a 15-minute consultation, get going. Right now, we're only virtual. We find that that works really well for people's schedules, people's lifestyles. If we see that there's a larger demand for others for in-person, we might expand to that. But basically, yeah, you log on to Resolve, and within a matter of a day or two, you can get a 15-minute consultation, $100 a session, which for private practice is on the lower end. That includes the taxes. And within a few days, you get very specific support. We have specialists that are working in particular areas. For example, we have an OCD psychotherapist. We have trauma. We have particular issues that if they're needed, you can go for the general approach, which the Resolve therapists there's a lot of training resources and manuals and things that we provide before they get onboarded so that they're really ready for the student life. But then we have greater areas of specialization as well. And all you have to do is go to the website, get an appointment within a matter of a couple of days, and have regular ongoing support. But there's a bigger goal. There's a bigger goal for me personally in this, which is that psychotherapy is not accessible and equitable for everybody. It's not something that's going to solve a systematic issue of mental health in our society. It's just too expensive. And although people do need individual support, and psychotherapy is immensely powerful for reasons other than skill building. Of course, people for this time are talking, they're sharing about their life. There's so much benefit that can come from being open about mental health with a trusted professional. But on a day-to-day level, the fact that students don't get access to learning the skills. Everybody knows, for example, basic ideas of mindfulness. They've sort of infiltrated into our society. And I'm not criticizing that. I think that there's a lot of benefit from learning about mindfulness. But mindfulness is just one piece on a much broader, like one piece of the iceberg. And there's a huge set of tools and skills from the mental health research world, the behavioral sciences, whether it's about acceptance and commitment therapy, dialectical behavior therapy, CBT, behavioral therapies, existential therapies. There are skills that are translatable to quality of life and improvement that you don't need therapy for. That doesn't mean that therapy doesn't have a role. So for example, if people got access to better education and they learned about intrusive thoughts from a young age, would that change their relationship with their brain when their brain starts telling them things that they've never heard that feel so counter to their values? Could we build more resilience by learning about emotion regulation skills and stress tolerance? And there's just so many skills that people can learn. And we are really trying to simplify and demystify therapy. Therapy ideas are not hard to teach. Therapy is complicated, how it works and the depth of insight, especially you get into more relational therapies, absolutely. But there are ideas, there are skills, there are tools, there are habits that are not hard to learn and grasp. And people should be able to have access to not just mindfulness, but imagine you had a huge toolkit that was so tailored to so many different issues. We think it would really help. And then we have peer support. Peer support, if you have a set of tools, maybe you have a therapist, peer support is an opportunity to just share what is going on in your life with people that are on the same level as you. They're not professionals. They've maybe had their own struggle, and you're talking, you're listening, you're being heard, you're learning about skills as well. You're speaking with so many different people for different walks of life. So we have these kind of three pillars: therapy, education, and peer support. And our goal is to really, for everybody, for what they need, that they're going to be able to access whatever it is that's going to help their mental health journey.
I love everything you just said about kind of the skills that come from therapy. And I think that's why such a big part of this conversation is about like bringing mental health education into the curriculum, because I feel like from such a young age, there's so much of that emotion regulation and just overall knowledge of mental health that we lack. And as we got older, we learn through experience. But if we had some of those skills and ideas kind of ingrained in us, it would be so much better to deal with life transitions and things that come up.
A lot of it is preventable. Now you're still going to have issues. There's no perfect system. It's not going to work for everybody at all times and all places. But even if you could mitigate, let's say 50% of the suffering, there's just people that are suffering that don't know how to handle and manage, and they do need skills and they do need tools. It doesn't need to cost so much to be able to get that. And if we teach, so in terms of curriculum, it can get complicated because it's hard to create courses, let's say. But even if you have teachers who are trained and parents, that's why I didn't mention, but a lot of our work as well is parent coaching and parent education. Because if parents have these skills and these tools, just like they teach their kids about responsibilities in managing chores and, being responsible and going to school and being respectful, they can then learn all these other skills. So in the home, you can learn it. In the school, you can learn it. It doesn't need to be a complete reinvention of the whole curriculum, which, by the way, part of the reason why Resolve is doing what it's doing is that we can respond to the market within seconds. A lot of these institutions have so many checks and balances, whether it's the school boards or it's the universities who have so many different people working at all this stuff, which is beautiful. There's a lot of amazing people in these institutions, but they will tell you, they've told me, we can't move very fast. We move at a snail's pace. Whereas for me, if someone said, I need this type of therapist for these issues, within a matter of days, we could adjust and adapt, because we're not, other than, of course, insurance and ethics, which we adhere to and do all of our work to be professional, we don't have a lot of checks and balances. We can respond to the market very fast. And I think that that's also an asset, because things are moving fast. And just talk about COVID, post-COVID. Can the institutions catch up to the impact of this? It's mind-blowing.
Mm-hmm. Yeah, I love that. And I think having a platform like that can be so adaptable and flexible is so needed for students, because like you said, often when people do reach out for help, they're faced with lots of barriers like wait times, costs, and things like that. So I love your platform. I'm so happy to be promoting it here on this podcast, and hopefully more people will be able to reach out and use those resources. But before we dive into the OCD and ADHD stuff, I wanted to ask, so you mentioned at the beginning that being a rabbi is very closely related to being a psychotherapist. And just because I love the topic of faith and spirituality, can you expand on that a little bit more? Just what are the similarities, and how have you used both experiences to kind of work together in your practice?
Thank you. Thank you for the opportunity to share. It's really, there's so much to say about this topic. I'll start just by briefly outlining that psychotherapy, as we know it today, which traditionally is understood to have began or started in like the late 1800s, early 1900s, something like that. We have psychoanalysis, and I'm going to get the dates a little bit wrong, but it's as if mental health, we started working on it, and the research has gone on is just the last 100 years. And the reality is, and this is well documented in so many different places, the idea about what is human life, how do we flourish, how do we deal with suffering, how do we deal with the world, how do we have good relationships? Marriages did not start 100 years ago. In fact, there's wisdom that transcends way this culture and any other culture. So you have that in the East and the West. We have so many faith and wisdom traditions that have had a lot to say about mental health. Some of that's being researched explicitly now, but this did not start. Conversations about mental health did not start. It's not a new thing. When people talk about the soul, they think it's like this otherworldly idea. But the reality is that we've been thinking about mental health. We have different words and different language. I'm very passionate about that. Not to mention that in the Jewish tradition, we are, how do I put this into words? We have worked for a very, very long time on these questions. Wisdom, meaning we've been going since Abraham, 5,000 years in an unbroken tradition about the good life and what does that mean, and how to live a meaningful life, and how to have good relationships and good institutions. And our track record is that we're still here. We're one of the most persecuted people ever, and our resiliency and our commitment to our values is very, very deep and very, very strong. And we do have a lot to offer, not just in a colloquial religious sense. So much of my religious practice and the values that I incorporate into my life are married to mental health wisdom and mental health practices. There's a major connection between Judaism and a lot of these major psychotherapists, researchers. You can get into Seligman in positive psychology, Beck in CBT, Freud in psychoanalysis, existential, Viktor Frankl. There is a direct connection, but simply we have a lot of tools and skills about things like compassion, gratitude, facing fears, dealing with pathology, having good relationships, good marriages, good in societies, good institutions, so many things. And so my hope, being Jewish, is two things in this practice of psychotherapy in mental health. Number one is to look at the best of what the West has to offer in the research and the science and the incredible detail that has gone into mental health in the last 100 years. Love it, love incorporating it, love learning it. I love amplifying it with Jewish wisdom because people need narrative and story. And sometimes Jewish stories are very specific to Jews, but other times not. For example, the story of the Exodus of Egypt and Jews leaving enslavement and slavery. That story has been used from Black freedom to, the founding of it's a story. It's a universal story about what it means to leave suffering and enter into freedom. And when I think about, for example, the work I do with exposure therapy, I'm helping people face things that they're afraid about and confront it. Through the Exodus story, for example, people are confronting. We tell the story every year. We face what scared us from the past. We don't avoid. So I do see an overlap. And so part of my work is how to make both of those better, how to use the best of mental health to enhance my understanding of Judaism, and how Jewish tools and wisdom, especially on all the areas I mentioned, can contribute to mental health as well. So a lot of the people that I work with are getting a major mix. That doesn't mean that I'm their rabbi, and I'll explain the difference. It's just that when I'm in a rabbi role, I'm providing like more specific religious guidance, and I'm looking at a whole different set of factors that I might not think about in mental health. Think about community and lifestyle that is not about just mental health. And of course, in mental health, you can talk about those things too. But a rabbi is more dealing with your community, answering questions about Jewish law. I'm not that kind of rabbi. I'm not learned enough to do big questions about Jewish law. But in terms of the alleviating of human suffering and helping people flourish, that is where a psychotherapist and a rabbi are linked to each other. And so I can't separate them. I can't separate the two identities. So that's where they're sort of interconnected. And not to mention that today, mental health, which as at one point was quite antagonistic to religion, Freud had all sorts of beliefs about religions, just that either that it wasn't valuable or that and I'm not too knowledgeable about it, but a primitive sense of religion, fantasy, et cetera, et cetera. And I might be getting some of that information wrong. Whereas today, people are doing research about the power of faith, how that impacts the power of religious community, the power of all these things to actually positively impact mental health. So I just kind of vomited a lot of stuff, but at the core, I care about mental health. I care about being a rabbi. I believe that the Jewish people and Jewish wisdom has a lot to offer for mental health. And I try to marry the two as much as I can in an ethical way.
No, I absolutely love that answer and appreciate all the word vomit. Thank you. But kind of just integrating that and acknowledging that these conversations are not new. They've been happening for thousands and thousands of years, maybe using different language, different approaches. But like you said, the fact of alleviating human suffering and finding a way to flourish, like that is what the conversation is at its core. So I love that you're able to integrate both of your experiences into one and really just serve and guide people in a way that makes the most sense to you, while also incorporating like so many different aspects of faith and spirituality.
Absolutely. And just the last thing on that, it's just so even the mindfulness, so much has come from Eastern thought. I mean, we're just working on let's optimize. Let's take the best tools about it. For the people who are into Stoicism, the philosophers, we've been really thinking about these questions for forever. Of course, research is the core, and we want to do research on the benefits of all these things. But yeah, absolutely. And so that's just part of my life. It's part of my life.
Amazing. Okay, so we're going to switch gears a little bit here. We have a few questions that were submitted in, and I'm going to apologize in advance. They are a little complex. So take a minute if you need to gather your thoughts.
Sure.
But we have 2 questions on ADHD and 2 on OCD. Do you have a preference for which one we do first?
No, I guess let's just go with exactly how you just did it.
Okay, amazing. So the first one is broad, but it is, how do I know if I have ADHD?
So that's a very hard question. And I have a lot of, I guess, bigger feelings about it. What I would do for sure is don't self-diagnose. The thing about ADHD is, and this is a big systemic problem, if you pay or you want to get a diagnosis, it's very possible that you can, because it is a lot of self-reporting. And on a spectrum today, people are more distracted. Their time management skills are worse. Their organization can be worse. We have all sorts of impulsivity. We can go through all the executive functions. People struggle with them. And so it's on a continuum, because even people that are not diagnosable still can benefit from ADHD type approaches to life. It can be beneficial to a lot of people. But I would say the number one thing is ask yourself, for some people, especially adults, I can tell you how many conversations I've had where it's been clarifying. So a diagnosis, maybe this is going to go to diagnosis. Diagnosis doesn't explain, or it's not a prognosis. Is prognosis the word? A diagnosis doesn't mean this is what you are, this is how life is, and this is where you're at, and this is it. No, a diagnosis means there are a cluster of symptoms that go together, and I don't diagnose as a psychotherapist. I'll just clarify that. A cluster of symptoms that go together that indicate that you have this label, and this label can be very helpful. For some people, it's like, oh my gosh, it gives voice to what I've known all along. There's so much, but it is not an explanation of your capacity and capability. It might mean naturally that you have more difficulties, and that's why you might benefit from things like medication. You might benefit from things like specific ADHD type psychotherapy and coaching. I would say, how do you know, is don't do that thing where you just look at a questionnaire, have a conversation. If you can't afford, which a lot of people can't, to get a whole psychological assessment, and it's not always necessary, you can get diagnosed and speak to a psychiatrist. We have that through our platform. We have access to psychiatry collaboration with low wait times. You can speak to a psychiatrist, do a proper assessment. And I would say also, very importantly, executive dysfunction is not only related to ADHD. For example, I was working with somebody recently who had an ADHD diagnosis, but upon a further deeper consultation I did with a psychiatrist, it actually came out that they had complex PTSD. With complex PTSD, if you have complex PTSD and you have symptoms of that, you might have major executive dysfunction. You might be totally dysregulated. You might have a very hard time focusing and concentrating, but you will not be diagnosed with ADHD if your diagnosis can be better explained by another mental health condition. So just be careful not to self-diagnose. And even if you do get diagnosed, be careful to look at that as an explanation for what you're capable of. When you get to the bare bones, and I work with this with people at the beginning of my work with ADHD, I say, you have this diagnosis, here's what it might come back. You might be struggling with inattentive. You might have different problems going on with your executive function. That doesn't speak to your capacity. So I want you to be brutally honest and raw with yourself and say, what is impossible for me to do? For example, tomorrow, if no matter what I wanted to do, I could not play in the NBA. It doesn't matter what I do. I'm not capable of playing in the National Basketball Association. There's limitations that we all have psychologically, physiologically, that are not possible. A lot of people get confused because they have executive dysfunction and they don't know, is that just who I am? Am I not capable? There is so much attack on our attention today. And that's just one example of executive function. There's many. So don't look at your diagnosis as this is who I am. Be very honest. What makes me more naturally difficult? Maybe I have a harder time with certain parts of my executive function, but that doesn't mean that I'm not capable of improving. So first thing I would say to getting a diagnosis is please speak to somebody who's testing for these things and get a proper assessment. You can speak to a psychiatrist or a psychologist and get a diagnosis. And there's also some cool other apps I've seen out recently. So we're eventually going to have psychological assessments with Resolve. As I mentioned, psychiatry consultations, you can get a diagnosis. I saw, I forget what it's called. I can link it later. I saw another website that does like, you just pay for an assessment for ADHD. I forget what it's called. I don't know, but you can skip wait times. It's cheaper. This is a Canadian initiative, a Canadian app. So that's also a possibility.
Amazing. Yeah, thanks for sharing that. I feel like you touched on a lot of great points, like the first, just that validation for the people who do have ADHD, knowing that you are not your label, you are not your diagnosis, you are so much more than that. And also the topic of self-diagnosing. I feel like social media has brought up a lot of that. TikTok, a lot of people see these things and they're like, oh, maybe I have that too, which is great for awareness and improving education, but it also brings on this other side of a lot of people kind of self-diagnosing, assuming that they have these diagnoses themselves. So I really like your answer and kind of just highlighting that professional help, get that diagnosis, that assessment, and then go from there.
Exactly. But if you resonate with it and you don't want to get a diagnosis, okay, take it with a grain of salt though. It doesn't explain your whole life. It doesn't explain what you're capable of and what you're not capable of.
Perfect. Okay, so the second question is a little more systemic in nature. It says, I have read that the prevalence of ADHD affects both sexes equally, but the rate of diagnosis for boys ranges for 3 to 7 times higher than women. Also, women are diagnosed later on in life. What does the future look like to make it more equitable for women suffering and changing the perceptions we currently hold that prevent these individuals from getting diagnoses? That's a lot.
I'm going to be very careful and say, number one, I work with so many women with ADHD. I don't know. I'm not going to say more than I know and more than I understand, but on a superficial level, I will say that in schools, the ADHD presentation that boys have is more about being a little like, misbehaving or not being able to sit still, like typical presentations, not focusing, and for women in schools that might not necessarily be the case. This sort of very visible, whoa, like we got these behavioral concerns. And this gets into a bigger discussion about, is there anything pathological of not being able to sit? Is that even is that the only way to learn? For example, and I think it's a very important thing to highlight. If you go into a yeshiva is a school for Jewish learning. Men and women go to different types of schools. You call them both yeshivas, typically just in general education. They do learn separately. That's a whole other discussion. But when you go into these places, it's not like going to the library. It's not like where you're sitting and just listening to information, somebody speaking all day. You might have a class where you're learning a topic and the teacher is presenting, but you are learning and engaging by screaming and talking it out and standing and walking and moving around and shaking your butt. Like, we automatically pathologize those things. And I'm saying maybe there's certain issues at certain times for certain people, but that's a bigger issue about whether that's the best way to learn. I don't know that that's the best way to learn, to sit and just absorb information. I hope people do group stuff and you walk around. So certainly it's not, I don't think it's natural for kids to be sitting that long. But that's why I think boys do have the diagnosis, and it's a bit more stereotypical at the beginning. Whereas there might be different things that women are struggling with that aren't as visible. And I don't know why. I don't know why that is. Maybe at one point it was more gender stereotypes, but I think today at the very least, you're seeing it more systemically with women later ages getting diagnosed. And that might be because it's less the things that you can see. Maybe some women are struggling with other types of executive function, whether it's certain levels of emotion regulation, or they struggle to remember all the responsibilities, and they feel lost, they feel overwhelmed, everything's all over the place, they're scattered. But in class, you're just kind of sitting there. So as long as you can sit and focus, that's my very superficial observation. And I don't want to say anything more because I don't know.
No, yeah, I think that's great. And it really, highlights for me when I read that question, I'm like, wow, that's deep. But it really does go to show that it starts in that first school system and kind of how these typical genders express themselves and how they're able to sit in your school setting. But yeah, no, that is really interesting to hear from your perspective. And I know it's so complex and can be broken down further, but I think that's good. Do you feel comfortable with that?
Yeah, I do. I just don't know too much about it, especially because I just try to help people with I try to help people improve their ADHD symptoms, both men and women. I do it in a very individual way. So we do executive function tests. We learn about very, very specific problems, but I don't know enough about on the broader systemic level and what's inequitable, what needs to be improved. But I think there's a lot of really good stuff out there. So people should do some research and look up what's going on in the field right now. How are women being treated better in this respect? What are some of the challenges? I just don't know it, and it's better to not say.
Yeah, I appreciate your honesty there. Thank you. And just kind of knowing that, you work with in a clinical setting, not necessarily that research. So thank you for making that clear. Cool. Okay. So we're going to shift gears again back to OCD now. We have two great questions. So the first one is, I've been dealing with OCD for the last 10 years, and sometimes my intrusive thoughts get the best of me. Can you share any suggestions or tips for not giving into these thoughts?
So one, I think, foundational strategy that I work with people, and there's many different layers to it, but on a very important, distinctive level, what are intrusive thoughts and what are thinking? What is thinking versus intrusive thoughts? So it's very important to be able to distinguish between the two. Intrusive thoughts, I actually call them, in OCD world, you have, on a very simple level, you have obsessions and compulsions. That makes obsessive compulsive disorder. Obsessions are, I have another word for them that I like to use called intrusions. They're whatever comes into your awareness, whether they're thoughts, feelings, physical sensations in your body, doubts, images, things that just pop into your brain, not out of nowhere. A lot of times they're triggered by something both internally or externally in your life. They come in and they kind of flood you. They take a seat. They welcome themselves in. So intrusive thoughts is one of the intrusions that people might have. So let's just talk about intrusive thoughts. That's an obsession. It's something that comes in without your conscious control and you can't stop it. So no matter what you do, you can't force yourself to not think about that pink elephant example when someone brings it up. So don't even try to get rid of your intrusive thoughts. And if anybody comes to psychotherapy to work on OCD and asks, I really want to get rid of my feelings and my intrusive thoughts, I say, I can't help you with that. I can help you learn to react differently to them and engage in your life differently, which will hopefully change your relationship with those thoughts so that if they do come up, they don't bother you as much and they come up less frequently as sort of a byproduct and a goal. But you can't control your thoughts. In terms of not giving in, it really depends what the voice is telling you, what the intrusive thoughts are telling you. But generally speaking, if you have an intrusive thought, that is something you can't control, but you can control the reaction. Sometimes the reaction to an intrusive thought is a behavior, something you do to disprove the intrusive thought or make it less powerful, less overwhelming. I think it's probably best to use an example. So, okay, if you have an intrusive thought, if a person has an intrusive thought, they're with a friend and they have an intrusive thought, oh, I might push that friend onto the subway tracks when they're at the subway. So a lot of people, that's really hard to handle. Am I a violent person? What does that mean? Oh my gosh, it's a crazy world. What's going on with that? Why do I think that, et cetera, et cetera? There might be a series of different compulsions or responses that you have to what you couldn't control, which was that thought. You might decide to think 14 different thoughts, think 14 different things actively that disprove that. You can say, here are all the times. Let me think about 20 times where I was a kind person because this thought's telling me I'm violent. So I'm internalizing that it means I'm violent. So let me think of 15 times and ruminate about all the times that I'm not. Let me also say, repeat in my head, I'm not going to do that. I would never do that. I'm a good person. I'm a kind person. That's a compulsion. It's a mental thinking. You can control your thinking, not your thoughts. That's thinking. That's an active behavior. You also might stop seeing that friend. I don't want to have those thoughts, so I'm going to stop seeing that friend. Maybe you stop taking the subway, which can be very disruptive if you need to get to somewhere that you need to go. Maybe you avoid. So you have rituals that you do called compulsions or avoidance in response to those thoughts. So when you ask about giving in, it really depends. What is your desired compulsion or avoidance to do? So if it's just to think and ruminate, it's directing your attention, using your senses to all the other things in life, because the thinking in this way is just a distraction. Going through and reviewing why you're not a bad person. Once you've decided that intrusive thoughts don't mean that I'm a bad person, and you've done a little bit of work on yourself to understand that it's OCD and it's not reality, or it's not helpful to look at the world in that way, etc., then you can do a much better job of just saying, okay, I'm not going to engage with you. I might have these thoughts, but I'm actually going to engage my senses in other activity. And someone might say, well, that's just distracting yourself. But is it? If you are having intrusive thoughts that are trying to make you do these things which aren't valuable and they're just noise and there's no reason to do them, then doing anything else is living your life. But if you were to do your compulsions, those are the distraction. So I would say if it's a mental behavior to start ruminating more, practice disengaging from your mind and engaging in other senses. And it might keep coming back, but you're not focused on that. Just go back to your life, and it keeps coming back, and get back to your life. If it's a behavior that it's compelling you to do, you have to starve it. That's the whole work of exposure therapy. Exposure and response prevention therapy is being exposed to your intrusions whatever form they come in, and not doing the response that you're used to. So you've got to practice disengaging from it and doing other things with your life that are more meaningful. And that's really, really hard to do. And that's why working with someone on an individual level is so helpful. But that's the core. The core of the work is to just let your brain and your body and your desires do whatever they want. And then learning what is the way that I want to live my life in response to those. And hopefully it's less compulsions and a more helpful, meaningful life overall. I think that's sort of my general answer to that question.
No, I love that. And the next question is kind of related, so I'm going to hold my thoughts until we discuss the next one. But it's, how can you tell the difference between OCD and superstitions? Like when you have to do something or you think something bad will happen, and they provided an example. So like in Italian culture, we have this thing called malocchio or evil eye, where people are talking bad about you and you kind of have to do these things to avoid the negative repercussions that will come from that.
Yeah, this is very interesting to me because of religious background and practices where it's all about the context and the function. For example, and this is why I'm very flexible as a psychotherapist when it comes to compulsions and behaviors, protective safety behaviors that people might do. Of course, if they're very pathological and they're ruining their life, that's a really bad thing that's really destructive. But some people have very minimally invasive safety behavior things they do. So you might just talk about, what you mentioned with in Italian culture about how to protect yourself from the evil eye. So let me ask you a question. First of all, are you flexible? If you didn't do it, or if you did it a little bit less than you would, and are you okay with it? Can you live with yourself? Or is this every time now that anybody says everything, has it become so disruptive to your life that it's taking over? The thing is about OCD, it's not about the behaviors themselves. It's about the context and the impact and the function. And I'll clarify that. For example, there's something called obsessive compulsive personality disorder. That is a type of personality that likes things to be clean and organized, which means that they may spend hours and hours and hours every time somebody comes over, every day they're mopping. But if you ask them why, they're not telling you, I'm doing it because I need to, and if I don't do it, it's terrible, and this is terrible things are going to happen to me. That's just a behavior that they do. Makes them feel better. Maybe their life would be a little bit better if they didn't do those things on some level. But I'm not getting into, that's why you have to be culturally sensitive and understand what is the function. So if you're doing something that is general in your culture and it's not too disruptive, from a clinical standpoint, maybe there are some people that use it in a compulsive way. But it's a behavior, and maybe you feel it's magical and it protects you, and maybe that makes you live a little bit kinder and feel a little bit better in social situations. Sure, it's not perfectly rational, but we're not perfectly rational beings. How is it impacting you? There is somebody that could do that ritual and spin it to take over their life. They can say, I can never be in a situation where that feeling of evil eye is going to come up, because otherwise I got to do that, and I have to do it 14 times in the exact formula, and it's going to take me hours. I'm going to feel so depressed and miserable about it. Then you have to be really concerned. But if you're just living, and sure, you would feel a little uncomfortable if you didn't do that, and it's not otherwise disruptive, it doesn't take up many minutes and hours. I'm not here to sniff all that stuff out. People have different ways of engaging with the world, and I'm not going to challenge that. If you feel it's true, if you feel it's right, if it's destructive, if it's disruptive, if it's hurting you and your relationship with yourself and others, I think that's the large barometer. So sometimes two identical behaviors could be done for a different function, and therefore be totally different. There are people that might be more cautious in cleaning, as an easy example, but that doesn't mean it's compulsive in nature. And you really got to learn about the individual and its function. But when a lot of people talk about this from the religious standpoint, when you get into superstition, we do look to normative practice. It is really important to understand, are you doing it the same way that everybody else does? Or if I were to ask 10 other Italians that do that thing, they'd really tell you that, yeah, we do that, but we don't do it 42 times in particular order. And then you got to get to, how disruptive is that? I think that might be a beginning to a question, but was that the question, was how do you know, or how do you differentiate?
Yeah, I think you did kind of touch on it, though. It's just like the larger misconception about OCD. Like some people can be uncomfortable if they don't do this thing, but when it actually causes distress, it's impacting your functioning, that's when it's like a clinical diagnosable disorder. So I think that did answer it. Are you good with that?
Well, a little bit, but yeah, some soup. So, we, and well, I don't know if you mentioned it's a cultural thing. Is it a religious thing too? Is it separate? Like, is that a Catholic, Italian Catholic practice that just become generalized to Italian culture? Is it someone's religious practice? I would want to learn about that for a second.
Yeah, I think that one specifically is more like your typical Roman Catholic Italian belief of when people are talking bad about you. Like we have like the cornies, you're supposed to like do this with your hands when your ears are ringing or when you feel that there's like negative energy around you. And we have like all our pendants and things to protect us from the evil.
And you know what? Like people have their practices and people have so much different cultural expression. And if you're working with a therapist and they just say, well, that's stupid, or why do you do that? That's just not what this is about. This is about flexibility, understanding people have different ways of looking at the world. But if you ask them, how does that impact you? And they say, you know what? It's fine. I do this for a second, or I do that. And you know, maybe it's not the most, you know, sensible thing every time, but this is what I believe and this is what I do. Or even if I don't even know if I believe it, but I do it anyway, because I think it's going to protect me. But if that person has to do this, you know, 25 times and they're in the middle of a meeting and they can't wait, and then you start to say to yourself, well, wait, where's the rigidity, the lack of flexibility that's disrupting you? Do you want to work on it? Some people don't want to work on their behaviors. And I just say, okay, can we still have a quality of life? And a lot of people can. Okay, maybe you have to spend 15 minutes doing these protective rituals that might not protect me, or they might, and I'm doing it as an insurance policy. If they don't want to change it, I wouldn't say that that's automatically something that's avoiding or that they need to change it. It really depends on the person.
Yeah, no, I think that's like the perfect answer because it highlights like everything that I said. When these behaviors, compulsions, obsessions start to take over your life and you have to leave a meeting to go do your ritual or whatever the context is, like that's when it can be considered something more. But these little things that are so ingrained in cultures and things, like some people assume that that's an OCD thing and they throw around the language like, oh, I'm so OCD, I have to do this. But understanding that on a deeper level and knowing that these things can just be protective factors, but they don't impact your life, whereas other people are heavily, heavily impacted by their compulsions. So I think that's a great point.
And sometimes though, there's sort of an avalanche, like you may have bigger rituals that people do, compulsions people do, and then there's these little ones that they still keep. Sometimes you can just keep them and they won't snowball, but there is a benefit, people that are really struggling, to really break all your rules that you think you need to keep just to become much stronger internally. And then again, that requires a sensitive focus to an individual person's life and what they really need. But I think generally speaking, cultural competency and sensitivity, that when you're working with someone, please bring these things up to your therapist. Don't worry that they're not going to, I mean, and if they don't understand, they should ask you and tell me more about that. We are really working on a broader societal scale, understanding diversity, but on an individual level, learn from other people who have unique experiences. And I'm also not, maybe that's insensitive to me, but I know that people say things like, I'm so OCD, and I hear it actually pretty much all the time. It doesn't bother me. I think there is a little bit of ignorance to it. And if they learned a little bit more, they might not say it, but we got to give people the benefit of the doubt. They're not trying to pathologize. I don't think generally they're trying to make fun of or pathologize. You can say, you know, I don't like that. And then talk to people, and, you know, they're not, you know, talk to people. I think is conversations with people that understand them is so helpful and so valuable, which is really hard to do online, I find, on social media. But that's a whole other discussion.
Yeah, I mean, personally, I would challenge that a little bit. I am just such a big advocate of language, and I feel like obviously everybody's different. It affects people differently, but like when I hear these terms thrown around, I think it just contributes to the lack of awareness and education. And I like that you said that, like, just having a conversation with people. And I like to use the mentality of like calling people in rather than calling them out. Like, you're not going to tear them down for saying that. You want to call them in and be like, hey, maybe we shouldn't be using those words, educate them, and that just contributes to like the larger conversation as a whole. So, I mean, to each their own, of course, but just
I love
trying
that.
to move in a more progressive way.
I love that approach. And I think that's really what I was going at. People are going to be bothered more by certain things that people say. But I like the idea of implicit in criticism and concern is when you say bringing people, calling people in as opposed to calling people out, is also being generous, that most people are not malice and they're saying something. And if you say, they'll probably stop. They'll be like, wow, I never thought about it like that. Thank you for sharing that. Let me be more mindful and more careful about how I communicate about something as sensitive as this.
And I think that's what a lot of it is just like innocent ignorance. Like they don't mean to be like that or whatever. They just don't know. So when we like have the opportunity to educate or inform, I think that's like where the most growth happens.
Yeah, for sure. So I think with a lot of these topics, there's so much learning, and I hope that Resolve also gets some of that out there. There's so much learning that people can do that can mitigate. If you're just learning about OCD for the first time here, don't base everything on our conversation. Same with ADHD. Do homework, do some research, look into different supports. There's a lot out there, and and we're hoping to continue to bring some of that stuff out there, and you can really learn so much and grow in your mental health. That's what I really feel about these kind of topics.
Yeah. And I guess just like wrapping up this episode today, if anybody was struggling, not OCD or ADHD specifically, what kind of words of advice or comfort would you give to them given your experiences, either as a rabbi, psychotherapist? Just how would you guide them?
So there's one core message and that I feel is extremely well. There's two words that come to mind, and it's really one message. Is that there is hope. There really is hope. This is something that is embedded into, of course, my own religious experiences and our history of hope. The Israeli national anthem is actually Hatikva, which is called the hope. Hope is the main ingredients of change. If you are living in your life right now and you think that nothing can change for me, I'm stuck, I'm lost, I'm alone, and I can't get any improvement, or I'm just the way I am. I have this diagnosis. There's nothing that can happen. That's not. I don't believe that is correct. Of course, I'm so sad with you that that's going on and that's how you see the world. But hope is the number one ingredient. Whenever I have 15-minute consultations, sometimes I'm speaking to people, and I know that I'm having hundreds of these conversations where someone's saying, "Here's what's going on," and I'm looking for help. I don't have much time. If I can help them, I say two things. Number one, I think I can definitely help you with these issues. Or number two, I can't. But no matter what, I will say, I'm telling you that there is hope. I have seen people improve their life and their quality of life with the exact same issues that you have. There is real hope that things can change. That's the number one thing. Just know that you are not stuck where you are right now in this moment. But it's not easy. And the second word I have is commitment. Commitment and a firmness to your valued commitments is unspeakably powerful. People don't, for example, and I'm a big proponent of breaks from social media, et cetera, how healthy they can be. We have it embedded in our lifestyle through the Sabbath. Every seventh day, we're offline from evening, from our days go by from the night. We start our day at night. We're a lunar people. So we go from Friday night to the end of Saturday night. It's firm, stable. It's committed. You don't have to make up the practice. It's got to be something that you show up to every single week, regardless. And so commitment to the things that you know are important to you is the second most important thing I'll say. If you want to get better, there's hope, but you're going to have to commit to doing a lot of work on yourself to get here. If you just think that coming to therapy, and for some people it is just coming, being able to be heard, have empathy for connection, those are unspeakably powerful, especially if you're socially isolated. But it's the work that you put into yourself and the firm commitment that you have, you will make progress. An unbreakable bond, giving your word for something, words can be very cheap. But if you take your word seriously and you commit, you can make real positive changes if they're in the direction of the world you want to live. So I would say the number one thing is hope. Know that there's a future, that there's better life, that doesn't have to be stuck where you were yesterday. But the way that you're going to make life better is firm, unbreakable commitments. And even if you can't commit a lot, I always counterintuitive. I always challenge people back. I say, you're taking on too much. I don't actually believe that you're going to do that. I'm sure if you really wanted to, you could, but what can you commit to? Not what are you going to aspire to? I mean, sure, aspirations are important. It's firm, stable commitment, whether that's just 5 minutes of something, 10 minutes of something, 20 minutes less on your compulsive behavior a day. I don't know what it is for you. Hope and commitment are the two things that I would leave off for people.
I absolutely love that. And I think that is such a perfect way to wrap up today's conversation. Just the fact that hope is real, healing is possible, but it's not easy. You're going to have to put in the work. You're going to have to make some tough decisions sometimes to put yourself in that best possible life situation that you can. So Noah, I have learned so much today, and I'm so grateful that we had the chance to connect. I'm going to put Resolve's link in the episode notes so anybody can check that out. But yeah, other than that, thank you so much for your time. I'm so grateful, and I hope you have a great rest of your day.
Thank you, and you too.